All right, so in week 3, we're going to talk a little bit about the nursing process and the Nurse Practice Act, and a little bit about population data. I know last week we looked at all these websites, or a few anyways, the World Health Organization and the CDC, and we're going to look at those again this week in your population data worksheet. I also want to say that my dogs may bark, and I don't want to remake the whole video if they bark, so I'm just letting you know that they might bark. All right, so the nursing process. We're just going to review it here. You're going to go over it next semester in great length. But for our purposes, I don't know why it always puts me in the presenter view. Okay. You'll see these names here. These are the names of the people who will teach you the next cohort of courses. And the nursing process, otherwise known as ADPI. It is a problem-solving decision-making process. It is the framework of which nurses do everything that they do. Okay, there's assessment, diagnosis, outcomes, or planning, implementation, and evaluation. And this comes right out of your text and the different things that you do in each part of the process. So this is a systematic collection of data. You'll collect objective assessment data and subjective. Objective is something you can, it's like, it's a lab value. INO, it's objective. You can see it. You can look at it. Subjective is how they feel. My knee hurts. That's subjective, right? Because what I think is pain and what you think is pain is different. So it's subjective. And from that, there's some different types of nursing diagnoses. Health promotion. So this would be a wellness diagnosis. A risk, maybe if someone is overweight, they're at risk for hypertension. Or if somebody already has hypertension, it's a problem-focused type. So a plan. You want to set a plan, right? What are you going to do for this patient? So your goal is a desired response. Your outcome is evaluation of your plan. So you set a goal with the patient's situation, and you want it to be SMART. Mrs. Smith will bike 1 mile. So specific who, what she'll do. She'll bike a mile 2 times per week. That's attainable and relevant by October 3rd. That's time limited. So implementation is an action in the nursing process. So you take the data and you say, this is what I'm going to do. An independent intervention is something that you can do within your scope and standard of practice. Ambulate a patient, turn them. A dependent intervention is something that you need a physician's order for, like medications. And then you want to say, hey, did we resolve this problem? And sometimes the answer to that is no. And then you just revise the plan. All right, so that is a brief overview of the nursing process.